so the quiz will commence in a little bit. So may I invite Dr. Sandamali to start the proceedings. So there'll be 10 questions that will be presented in front of you, and we would advise that you log on to the system with your individual accounts so that you can answer them. And please do remember that there are valuable prizes up for grabs, first, second and third place for the correct answers. So please show some enthusiasm. I'm sure that you are all of you would have been listening to the lectures quite attentively. So hopefully there will be nice participation here as well. So over to Sandamali for the quiz.
Thank you, Chamara. These are very simple questions. Unfortunately, we have run out of time, so I need to go through the questions quickly. But first 2-3 questions I will go slowly, so you will get the hang of voting the correct answer. It is a best of 5 type of answer, so you need to find the best suitable answer and click on that. Shall we have the first question, please? Okay, first question is, which one is not a sign of respiratory distress? Please bear with us. Go through this screen. Will we get the... I can see that you have answered. I'm sorry, I didn't get the question to my screen, so that's why I couldn't go through the question. So the question was, which one is not a sign of respiratory distress? 1, cyanosis. 2, increased respiratory rate. 3, reduced oxygen saturation. 4, inability to speak in full sentences. 5, lower abdominal tenderness. Since I guess you all have voted, can we stop voting now? We have given enough time, I think. Yeah. And yes, the answer is number 5. That is, low abdominal tenderness is not a sign of respiratory disease, it's a sign of other clinical conditions. Can we go to the question number 2, please? Okay. Second question is, which one is not correct regarding management of acute liver injury in cardiogenic shock? 1. Avoid constipation. 2. Monitor urine output and renal functions. 3. Avoid hepatotoxic medications. 4. Look for infections. 5. Using IV contrast is contraindicated. Start voting now, please. Okay, stop voting now. The answer is number 5. Actually, IV contrast, using IV contrast is contraindicated in acute kidney injury, not in acute liver injury. Yes, all of them have got the correct answer. We can see that. Good. You have been listening to the lectures, and all other responses are correct responses during management of acute liver injury. And can we go to the question number 3, please? Which one is not a cause of acute chest pain? 1. Acute coronary syndrome. 2. Costochondritis. 3. Esophagitis. 4. Acute appendicitis. 5. Pulmonary embolism. I think it is an easy question, so we can stop voting now. And the answer is, have we stopped voting? Yeah. Answer is number 4. Sorry. Yeah, correct. Acute appendicitis, it is not a cause of acute chest pain, but all the others can cause chest pain of acute onset. Next question, please. Which is not recommended in the management of extreme bradycardia? 1. IV atropine. 2. IV isoprenaline. 3. Transvenous pacing. 4. IV verapamil. 5. Transcutaneous pacing. You can get the correct response by sort of like excluding others. I think it's time to stop voting now. Okay, the correct answer is number 4, IV verapamil. It is given actually in the management of tachycardic events like supraventricular tachycardias. All the others are given used in the management of bradycardia, IV atropine, isoprenaline, transcutaneous or transvenous pacing. Transvenous pacing is what we do during temporary pacemaker insertion. Next question, please. In which clinical condition anticoagulation is not used? 1. Hematemesis. It is the technical term for upper gastrointestinal bleeding. Number 2. Pulmonary embolism. Number 3. Atrial fibrillation. Number 4. Prosthetic heart valves. Number 5. DVT, prophylaxis, deep venous thrombosis prophylaxis. Please start voting now. Okay, you can stop voting now. Of course, most of you have got the correct answer. It is the hematemesis, so upper GI bleeding. During bleeding, we don't give anticoagulation, which are actually blood thinners. In every other condition, pulmonary embolism, atrial fibrillation, prosthetic heart valves, and DVT prophylaxis, we do use anticoagulation. Can we go to the next question, please? Which response is incorrect regarding cardiac rehabilitation? Number 1, cardiac rehabilitation is a multidisciplinary teamwork. Number 2, it is not indicated after coronary artery bypass grafting. Number 3, phase 1 of rehabilitation starts during hospitalized period of the patient following an acute cardiac event. Number 4, cardiac rehabilitation reduces cardiovascular mortality and morbidity. Number 5, improving coping skills to handle stress and anxiety is a part of cardiac rehabilitation. Please start choosing the correct answer. Okay, you can stop voting now. The correct answer is number 2. It is actually indicated after coronary artery bypass grafting. Even after acute MI, any acute event of acute coronary syndrome, and after heart failure and episodes of arrhythmia, and after open heart surgery like bypass surgery or valve replacement surgery, cardiac rehabilitation is indicated. So that is the incorrect response. All other responses are correct. Shall we go to the next question, please? In cardiogenic shock, acute ST elevation myocardial infarction is not a recognized cause. That is first response. Second response is lactic acid is not elevated. Number 3, correction of arrhythmia should be delayed until patient recovers. Number 4, underlying etiology should be identified and corrected. That is what I meant was underlying etiology of cardiogenic shock should be identified and corrected. Number 5, adrenaline is not used in the management. Please choose the correct response now. Okay, you can stop voting now. Majority of you have got the correct answer. The correct answer is underlying etiology should be identified and corrected. Of course, acute ST elevation MI is a recognized cause. Lactic acid is elevated during cardiogenic shock, and arrhythmia should be corrected because it is a cause of cardiogenic shock. So it should not be delayed. We should not wait until patient recovers. And adrenaline is used as a in inotrope support in the management of cardiogenic shock. So the correct answer is number 4. Etiology should be identified and corrected as soon as possible. Can we go to the next question, please? Which equipment is incorrectly matched to its function? So you need to see the equipment and its function, whether it is correctly matched. Number 1, high flow nasal cannula to deliver pressurized oxygen. Number 2, intra-aortic balloon pump. I'm sorry about the mistake there. It should be IABP, not BG, to improve coronary circulation. Number 3, ECMO to support liver function. Number 4, CRRT to support kidney function. Number 5, MAS to support liver function. Please start voting now. Okay, you can stop voting now. I'm sorry, I'm rushing through the questions, but we need to finish this in time. So, correct answer is number 3. Thank you. Most of you have got the answer correct. ECMO is used to support the heart and the lung, but eventually it will support liver, but the primary function is to support the heart and the lung. The others are correctly matched. Can we have the next question, please? Which is incorrect regarding COVID-19 infection and cardiovascular diseases? Number 1, patients with cardiovascular disease tend to have higher rate of adverse outcome when infected with COVID-19 infection. Number 2, COVID-19 can cause myopericarditis. Number 3, acute coronary syndrome from plaque rupture and thrombosis cannot occur in COVID infection. Number 4, transesophageal echo is a high-risk aerosol generating procedure. Number 5, door-to-balloon time is allowed to delay up to 120 minutes during COVID pandemic. Please start voting now. You can stop voting now. Actually, there is a little bit of confusion regarding the question. The correct answer is acute coronary syndrome from plaque rupture and thrombosis cannot occur in COVID infection. That is incorrect. They can occur during COVID infection. All the other responses are correct responses. So that number 3 is the incorrect one. Transesophageal echo is a high-risk aerosol generating procedure. Dr. Shanika listed all those procedures and TO is one of that. Okay, can we go to the next question, please? Which one is the wrong statement? This is mainly for the radiographers, but I hope others will also get this correct. In LAO view, catheter and spine are seen on the right side of the image. Number 2, caudal views are better to visualize LCX artery. Views are better to visualize LCX artery. Spider view is used to visualize distal LAD. Scatter dose of radiation is lower when distance from the patient to operator is increased. Appropriate protective lead garments must be used to reduce radiation exposure. Okay, you can stop voting now. Most of you have got the correct answer. It is that spider view is used to visualize the distal LAD. That is wrong. It is used to visualize the left main, mainly left main and proximal LAD. Right, other statements are correct. The third one is wrong. Have we finished questions? Yes, that is the last one. Okay. Thank you so much for participating in the quiz. Unfortunately, I cannot give you the results right now, but within this day, during this program, we will give you the results and you will be informed by email from your contact numbers, and the prizes also will be handed over in due course. Thank you so much for participating again.
Thank you very much, Dr. Sandamali, for the quiz, and I hope that everybody enjoyed it. Looking at the responses, I think people have actually been listening quite intently, and it's quite encouraging to see that majority of the correct answers were given as well. So that's excellent. So so that kind of concludes the proceedings, the Allied Health Professionals program for this academic sessions, which was held fully virtually. We plan on continuing this tradition as well in the future. And I would like to actually take this opportunity to thank the two course directors, Dr. Sandamali being one, and Dr. Dhananjali Seneviratne, who unfortunately could not be here with us today. But however, she is joining us online, and she will be delivering the vote of thanks. So, Dr. Dhananjali, are you available with us? Can see you. Hello, hi. Can you hear us?
Yes. Yes, Chamara.
Hi. Thank you very much for joining us.
Hi, Chamara.
Ladies and gentlemen, I'd like to introduce consultant cardiologist Dr. Dhananjali Seneviratne, one of the course directors of the Allied Health Professionals program for this year, to deliver the vote of thanks. Over to you, Dr. Dhananjali.
Thank you, Chamara, for the introduction. Good afternoon, distinguished ladies and gentlemen. I deem it is a great honor and privilege to propose the vote of thanks in this program. First and foremost, I would like to express my heartfelt thanks to Dr. Anindhu Pathirana, the President of Sri Lanka College of Cardiology, the Council and the members for organizing annual academic session 2021 in this challenging situation with global COVID pandemic. At the same time, and the guidance and the support given to us to succeed this event of Allied Health Professionals program. I take immense pleasure to extend in my sincere thanks to all the speakers involved for their dedication, accepting our invitation without any hesitation, finishing lectures timely according to schedules. I think it is very difficult with your busy work schedules. I'm much thankful to all the consultant cardiologists, directors, and the organizing teams in all the hospitals for helping us to conduct the satellite programs. Dr. Chamara, consultant cardiologist in Ah16 group of hospitals, and the Dr. Aruna Vijayasinghe, consultant cardiologist, Base Hospital Panadura. Thank you, my dear colleagues, to giving hand to conduct the live session. I owe special gratitude to Mr. Riza, the country manager, and the AstraZeneca team for their immense help and support in arranging this event in big scale. This is the first time to arrange satellite meetings in all the hospitals with the consultant cardiologist in Sri Lanka, including private hospitals. 40 stations arranged, and the number of participants more than 1,500. So it is a big challenge to coordinate these centers and the resources. So thank you again, Mr. Riza and the team, for your dedication and the enthusiasm. I must thank Mr. Kamal and the Global Events, our audiovisual team, and the manager and the staff of the Hotel Hilton for their assistance. It is not complete if I don't mention my co-course director, who bared most of the weight in this event, Dr. Sandamali Premaratna, consultant cardiologist, District General Hospital, Polonnaruwa, for taking hand with me to accomplish this event. I express my gratitude to all the participants. Without you all, this won't be success. Finally, I'm thankful to all the helpers and the organizations who I could not mention the name for their kind help and support. At the same time, I take this opportunity to apologize for any convenience caused by shortcomings. Thank you very much and best wishes.
Thank you, Dhananjani. So we have come to the end of today's session. I hope you gained much and enjoyed the session. And we hope to see you next year, preferably in person, in a world where we are free of COVID infection. So until then, goodbye. Thank you for participating.